Very good morning to all of you present here.
नीचे रखो माइक
नीचे
तो डबल वॉइस है,
इको हो जाएगा।
A very good morning to all of you present here. And first of all, I am very thankful to all of you for making this time and coming here this morning. I am Dr. Shilpa Kodakany. I am the Chief Consultant and Medical Director of Dr. Kodakany's Eye Center. We have all gathered here today because our hospital, Dr. Kodakany's Eye Center, is merging with Dr. Joshi Eye Institute from Hubballi. Of course, Joshi Eye Institute has many centers across North Karnataka, and now after our merger, they are coming into Belgavi also. So today we have amongst us Dr. Guru Prasad AS, who is a senior vitreoretinal surgeon in Joshi Eye Institute. He has almost 40 years of experience in the vitreoretinal segment, and I remember many years back he used to come to Belgavi for consultation, and he had come to Belgavi and I had taken one of my patients there whom I had operated on, and when he said, "Shilpa, wonderful surgery," I was on top of the moon that day. So that is the kind of respect that Dr. Guru Prasad commands today in ophthalmology. Then we have amongst us Dr. Krishna Prasad. He is the glaucoma, cataract, pediatric ophthalmology, orbit, oculoplasty, all in one. So he is like an all-rounder of Joshi Eye Institute, and he is amongst us today. And also we have Dr. Satyamurthy, who is the cataract and refractive surgeon of Joshi Eye Institute. He is a big cataract surgeon. He is a very good surgeon, and refractive surgery meaning removal of spectacle numbers. So he specializes in that, and he is also a cornea surgeon. He does a lot of corneal transplant surgeries and he also runs the eye bank in Joshi Eye Institute. So we have the three of them amongst us. Unfortunately, another doctor from Hubballi, that is Dr. Srinivas Joshi, he could not come today. He is a little unwell. He is also a vitreoretinal surgeon, and he has trained with Dr. Guru Prasad and also in America. He is also a vitreoretinal surgeon, and so we have a whole gamut of consultants in Joshi Eye Institute who are going to give their services in Belgavi also, and they have also trained me and my consultants who are here in Belgavi for the future and for newer technologies that we are going to be talking about now. So thank you so much. And on my left, of course, I always take them for granted. This is Mr. Kirti Nerlekar. He is my husband. He is also the director of Kodakany Eye Center. And we have Mr. Rajendra Belgamkar. He is the financial advisor and consultant of Seneca Consultancy, and he is also the director of Kodakany Eye Center. So we have amongst us all our people here for this press conference today. So I would like to start off with a small video about certain technologies that we would be bringing to Belgaum. One of them being, play the video first. You know which one, no? So this is a machine which is the Z-Mode machine, which has been introduced about 1 year back in Joshi Institute. So this is a small snippet of what it is about. So earlier this kind of huge machines used to be there, but now with this cutting edge technology.
Can you pause this? Just a second. Okay. See, you all must have heard of robotic cataract surgery, isn't it? With the help of laser, we can do the cataract surgery. Same thing we used to do earlier with a machine fixed at one place, whereas that used to do only that. So that was so now, whereas this particular thing, which is latest in the world, so what it is you can use robotic surgery. It is portable. You can take it from place to place and then do it. And then it may not, patient need not go to one particular place. It can be taken to the operation theatre immediately after the laser treatment, robotic surgery. You can continue with the remaining, putting the lens and other things. So that is our advantage. And then the other features of this particular machine is the latest thing in removal of glasses. You all must have heard of smile. In the world, there is something called the clear. That is also to remove the glasses, glass number that this machine does. It can be done in Belgaum, it can be done in public because it can be carried anywhere. And third thing is this corneal grafting, what we were all Dr. Shilpa was talking about, where this corneal blindness. Earlier we used to use griffins, blades. Manually we used to do it, but now same thing with more precision can be done with the help of this particular machine. Okay, and then after that we can continue with the treatment. And then there are other things like there are some intracorneal ring segments which are you all must have heard of intacs for keratoconus and things like that. This machine also can do all that. And then between Bangalore and Bombay, so this is the only place where the machine is available. And this machine station in Hubballi can be brought to Belagavi, can be taken to anywhere in North Karnataka. Next time North Karnataka, this is the only machine. So with this removal of glasses, it takes hardly 2 minutes per eye. So within 5 minutes, the patient will go. Both eyes are treated at the same time, and then 5 minutes, the patient can come out. Okay. So that is the advantage. The advantage of this particular technology is that the precision is very good, and then the person can get back to work at the earliest and can indulge himself in all types of activities, including sports and then water sports also. So that is the advantage. Yes, this one.
So this is a laser machine which is able to give very precise and accurate vision to patients of all age groups. So it can take care of cataract surgery, it can take care of cornea, that is spectacle numbers, it can take care of patients who require the corneal transplants, that means after eye donation, the cornea is taken and it is transplanted so that we can give vision. So because it is being done without a blade, it is with the laser that the cuts are being made. It is very, very precise. Because it is precise, it gives much better results. And this is how the laser technology has become so mobile now. Earlier, we needed one machine for cataract, one machine for cornea, one machine for removal of spectacle numbers, and all of them used to be big machines. So we needed 3 different rooms for 3 different things. Now we do have 3 rooms, but the machine is only one, and it is just wheeled from one cataract operation theatre to spectacle removal operation theatre to cornea theatre. That is how it moves from one place to another. And that's why it can also move not only from one room to another, it can move from one city to another. That is how it is. We are able to bring that technology to Belagavi today.
The latest technology in the world has come to Belagavi.
Costing cost-wise how much?
The machine, the cost of the
No,
machine.
not machine. I mean,
Machine cost is also important to, in the beginning, it costs around 6 crores to buy the machine and a very huge maintenance. See, obviously the cataract surgery, what we call the robotic surgery, it is definitely is having a premium. See, they have told a lot of technology, a lot of technical terms. For non-doctors, it's always very confusing. I'll make it very simple. See, cataract, there are a lot of new things that come in cataract surgery every day. I thought of why. Because everybody needs cataract. वो दूसरी सर्जरियों में ना कभी कभार होता है कभी नहीं होता है, it's like that. But everybody has 2 eyes and everybody in their lifetime has to come to a cataract surgery. कोई इससे बच नहीं सकता. दोनों आंखों की सर्जरी का जरूरत है ही. So that means everybody, it is such a huge potential for cataract surgery. So the research and development and all the new technology, there is a lot of investment in trying to find out what is the best. So जब सबको सर्जरी होना ही चाहिए, तो सबसे लेटेस्ट तरीका जल्दी से आता है. See, when we do surgery, you must start off good surgeon, not so good surgeon, experienced surgeon, वो सब तो होता है. एक surgeon is a very experienced surgeon. In 1 lakh operation, there is a one problem in one patient, let's say. Then the surgery is very good. 1 lakh में एक ही तो problem हो सकता है. But for that patient, it is 100%. So there is always a small error of human error that is possible, humanly possible. सब गलती करते हैं, human error होता है. So there are certain steps in the cataract surgery which are very important. Basically, making an opening in the lens. It should be perfectly circular. It should be 5 millimeters. The lens is cut into small pieces before it is removed, or a small opening. So what we do is we use a called femtosecond laser. ये लेजर का नाम है femtosecond laser. उससे ऑपरेशन से पहले ही हम एक परफेक्ट 5 मिलीमीटर सर्कल का ओपनिंग बनाते हैं एंड कैटरैक्ट को छोटे छोटे टुकड़े में पहले ही बिफोर वी टेक इट टू द ऑपरेशन थिएटर इट इज कट एंड देन इट्स वेरी इजी because the main job is already done with the robotic technology with highest precision, highest accuracy. So surgery is fast and very, very, very safe. See, for the safety of the procedure, any amount of money is still insufficient.
But still, there were, when we are considering about the patient's factor, it's costlier. As the technology is newer, the cost will be more.
Yes,
It's the scenario that is happening in the medical field. So, how it can be made patient friendly or it can be made economically?
Exactly. So it's basically the economies of scale. When more and more patients actually opt for new technology, every technology price will come down. See, now we, Joshi Institute, even Kodakany Eye Center have been known for a very affordable pricing for all economic sections of society. We don't only treat the very neo-rich. So basically we have every kind of patient in our, as our clientele. So we would like to stick to that philosophy even with the new technology. In fact, our pricing is almost like 50 to 60% of what is available in the metros. It's very, very affordable. Basically, it is to add a new technology to the gambit. It is not as a commercial venture. Otherwise, it is not commercially viable. It is a very poor business sense to bring any new technology to Hubballi or Belagavi. but it is only to complete the, so that nobody is deprived of this technology. So this ZITE machine, since it can be moved from one place to another, it actually is a very delicate machine, but it has got a very special carrier. We have designed a special vehicle which is fitted with a very special interiors.
So
to bring
you
the
can
machine
see
to-
there
Okay,
that
this
the
is the technique. This is a exclusive vehicle to only carry that small machine. Machine is small, it's portable, so it can be brought to the operating room of Kodakany Eye Center, and we can do a laser cataract surgery. We can also do refractive surgery. This is such a small machine.
Even if a person wants earlier robotic cataract surgery, patient have to go to Bangalore or Bombay, any of the big metros.
So this is how the machine is kept inside the vehicle. It is because it has to be protected also. It has got, the vehicle has been made in such a way that special shock absorbers have been put up. I think it took almost 6 months to get the vehicle
Customized for this.
refurbished and customized for this particular vehicle.
So the operation can be done in the vehicles only?
No.
No.
Not.
It's only carrier vehicle.
Carrier.
Only the
Well, as I thought,
How
So
much
it-
will that cost, like, for surgery, eye surgery?
Yeah, it
On
will-
an average, 50?
So this
60,
is how the machine is brought from one place to another. Like now, once it comes to Belgavi, we will bring it into the basement area. The vehicle will come into the basement area. From there, through the lift, it will be brought up to the operation theatres. We have to do these surgeries in the operation theatre, especially where eye is concerned. We have to be very careful with infections. So that is why it is very, very important that we do these surgeries only in an operation theatre. Only the vehicle will move. We cannot do surgeries inside the vehicle.
मॅडम अलीकडच्या काही वर्षामध्ये मोतीबिंदूचे रोग वाढले होते त्याचं कारण काय आणि दुसरं एक प्रश्न त्याला जोडून की जर एक जण सांगायला लागलेलं की अत्याधुनिक पद्धतीने आपण ही शस्त्रक्रिया करणार आहोत त्याचा मिनिमम खर्च किती आहे जास्तीत जास्त याची आकडेवारी तुम्ही सांगा
Okay. So about
I can take that. See, वो जो टेक्नोलॉजी है वो अलग अलग तरीके से करते हैं. वो स्माइल करके एक प्रोसीजर करते हैं, फेमटोलासी करके एक प्रोसीजर है, इंट्राकॉर्नियल रिंग्स करके. उसी टेक्नोलॉजी से हम अलग अलग प्रोसीजर को करते हैं. तो हर पेशेंट को हर टेक्निक का मतलब एक टेक्निक एक को सूट होता है एक को नहीं होता है. तो पूरा जांच करने के बाद, टेस्ट केयर करने के बाद कौन सा टेक्निक से सबसे बेस्ट विजन आता है. So it can vary from anywhere from 40,000 to 1 lakh depending upon the technique. It can be as less as 40,000 to 1 lakh depending upon the क्या technique है. And also there is a huge consumables along with it. It's not just a machine. उसके साथ तो बहुत कुछ
these
खर्चा.
any government schemes collected for such type of operations?
No, madam. This is basically, see, government schemes are basically for the people who cannot afford. So we have, even Kodakany Eye Center is doing, you can see the board there, for poor patient, they are doing free cataract surgery. So right now, Karnataka government is not supporting even that. That's a different issue, we'll not go there. We as, just because of philanthropy and this social commitment, we are doing that. That is the base of the pyramid actually. We are in the middle and the top of the pyramid. So ये जो है, ये टेक्नोलॉजी के लिए. समझ लीजिए, वो मेरा आंख, मेरी विजन, मेरी कैटरेक्ट सर्जरी मुझे बहुत इम्पोर्टेंट है. I don't mind spending little more if I want 100%. अगर आप समझ लीजिए मेरा ऑपरेशन के लिए मैं क्या सोचूंगा. Will I also cut cost से मुझे थोड़ा कम नजर आया तो चलेगा, मैं थोड़ा कम दे दूंगा. No, I want my best. So when it comes to vision, समझ लीजिए आंख की मतलब विजन के अलावा क्या है. Vision is very important. So everybody thinks like that. So people who have money.
नहीं नहीं लेकिन पूछना ये चाह रहा है कि अटैक मोतीबिंदु के पेशेंट्स क्यों बढ़ रहे हैं
क्यों बढ़ रहे. सर मोतीबिंदु बीमारी नहीं है, इसीलिए मोतीबिंदु जैसे हमारी बाल सफेद होता है वैसे मोतीबिंदु सबको उतरता है. मोतीबिंदु एक बीमारी नहीं है. मोतीबिंदु से एजिंग प्रोसेस, उम्र के साथ जो हमारा शरीर में जो बदलाव होता है उसमें एक जैसे ग्रेइंग हेयर इज सो बढ़ नहीं रहा है. ओनली थिंग इज लोग जल्दी ऑपरेशन के लिए आ रहे हैं. नाउ सर्जरी हैज बिकम सो सिंपल, सो सेफ एंड सो कंफर्टिंग एंड सो सिंपल. 5 मिनट में डॉक्टर शिल्पा ऑपरेशन कर देना, अगले दिन से वापस जा सकते. इतना आसान हो गया तो पेशंट क्यों बैठते हैं?
आणि दुसरी गोष्ट म्हणजे आधी मोतीबिंदू व्हायचा, पण आम्हीच सांगायचो पेशंटना एक 50 वर्षामागे की पूर्ण पिकल्यावर मगच ऑपरेशन करायचं. पण आता तसं नाही आहे का, म्हणजे तेव्हा 50 वर्षामागे आमच्याकडे मशीन्स असे नव्हते. आम्ही हाताने करायचो, मोठी जखम करायचो, टाके वगैरे घालून करायचो. म्हणून तेव्हा आम्हाला पण मोतीबिंदू क्लिअर दिसायला आम्हीच सांगायचो पूर्ण पिकायला थांबा, म्हणजे तो पांढरा पांढरा व्हायचा पूर्ण. पण आता तसं नाही आहे. जरी थोडा मोतीबिंदू असेल तरीही आम्ही तो काढू शकतो. आणि आजकाल टेक्नॉलॉजी अशी आहे की आम्ही ते अगदी कमी प्रमाणात मोतीबिंदू असेल तरीही तो चांगल्या रीतीने काढून दुसरी लेन्स बसवू शकतो. आणि आता लोकांना सुद्धा, आम्हाला सगळ्यांनाच, आम्हाला टेक्नॉलॉजी वापरून इतकी सवय झालेली आहे. मोबाईल फोन्स, आता आधी तुम्ही पण एवढे मोठे कॅमेराज घेऊन यायचे, आत्ता मोबाईलवरती सगळं होतंय. तर तसंच आमच्या पेशंट्सना सुद्धा मोबाईल दिसणं हे खूप गरजेचं झालेलं आहे. आणि म्हणून
मोबाईलवर डोळे खराब व्हायला
हां,
लागले.
आजकाल पेशंट मला लांबचं दिसत नाही म्हणून सांगत नाही, मला मोबाईलवरती लिहिलेलं दिसत नाही आहे असं म्हणून कंप्लेंट घेऊन येतात. तर तसं टेक्नॉलॉजी इतकं वाढल्यामुळे, इतकं पुढे गेल्यामुळे आज मोतीबिंदू लवकर काढावा लागतो. लेन्सची लाईफ लॉंग आहे. अंदाज असं नाहीच, लाईफ लॉंग आहे.
सर्वसाधारणपणे 15 ते 20 वर्ष.
नाही, आता
वो भी रहेगा. हम 1 साल के बच्चों के लिए वही लेंस डालते हैं.
हाँ.
बच्चों में भी कैटरैक्ट होता है, उनको भी वही लेंस डालते हैं. जब तक आदमी रहेगा तब तक लेंस पे रहेगा.
म्हणालीस ना की मोतीबिंदू लवकर पूर्ण पिकण्याची सुद्धा आता गरज नाही. हे लक्षात येण्यासाठी पेशंटची काय जबाबदारी, जे की मंथली क्वार्टरली कसं?
हां, एक म्हणजे पेशंट्सना स्वतः कळतं की मला आता क्लिअर दिसत नाही आहे, मी चष्मा घालून सुद्धा मला वाचता येत नाही आहे किंवा लांबचं दिसत नाही आहे क्लिअरली चष्मा घालून सुद्धा. खूपसे पेशंट असे आमच्याकडे येतात, माझा चष्म्याचा नंबर बदलला आहे, मला नंबर चेंज करून द्या. पण जेव्हा आम्ही चेक करतो तेव्हा दिसतं की मोतीबिंदू आहे. तसं असतं. म्हणून एक 6 महिन्यातून एकदा किंवा 1 वर्षातून एकदा सगळ्यांनी चेकअप करून घ्यायला पाहिजे. आणि हे फक्त मोतीबिंदूसाठी नाही, कितीतरी डोळ्याचे विकार आहेत. ग्लॉकोमा म्हणजे डोळ्याचं प्रेशर वाढून मागची नस खराब होते, किंवा रेटिनावरती मागच्या पडद्यावरती कितीतरी प्रॉब्लेम्स होतात, जसे डायबिटीजमुळे मागचा पडदा खराब होतो, किंवा वयानुसार एज रिलेटेड मॅक्युलर डिजनरेशन म्हणतो. त्याच्याबद्दल गुरुप्रसाद सर आहेत आमच्याबरोबर आणि त्यांचं खूप एक्सपिरियन्स आहे या फील्डमध्ये, तर ते तुम्हाला जास्त सविस्तर सांगतील. एकच
About the timing of cataract surgery, you have asked a few questions. That's what I understood in Marathi. But previously they had to wait for the cataract to mature. That was the technology available at that time. That means an immature cataract could not be removed with the available equipment and technology. Today it is possible to customize time the surgery in such a way that the patient can have clear vision throughout his life. Even if he has less vision and he is not able to do his routine activities like reading, writing. A driver, for example, a driver needs very clear vision for distance. So if his vision is even slightly, even 10% reduced by the cataract, that can be operated. A farmer, on the other hand, a farmer who works in the field, on the other hand, did not get it operated because he can manage most of his activities. So it depends on the occupation of the patient, the needs of the patient. If the patient is is dependent on clear vision for his daily activities and his earning, then he can get it done early with the present technology. Yeah.
No, but you didn't see the dependence on glasses as from a child to elderly person. We keep on depending. So after 40 years, we need glass for reading and other things. Isn't it? So for all ages, you can get rid of the number, including after cataract surgery, they put a multifocal lens and then they can see better. See, for a younger age group, we can remove the glasses. So this one machine can remove glasses for all ages. That's the thing.
Yeah. About it is mentioned the retinal laser photocoagulation, but first of all, let me tell you what retina is, because that is the basis for the next part of my presentation. Retina means the innermost layer of the eye, what is inside, deep inside, and when the light passes to the clear cornea, clear lens means without cataract, it will pass through and focus on the layer which we call retina or Akshipatala or in Hindi I don't know what it is called. Parda. So this retina is having blood supply like any part of the body. Every part of the body has a blood supply, and we can actually see this blood supply in the retina, blood vessels in the retina, with the help of our equipment, the help of ophthalmoscopes we call it, with the direct ophthalmoscope, with fundus cameras, with indirect ophthalmoscope. So many equipments are available for us to see what is inside, what vessels are inside, what is the condition of the vessels, and looking at them, we can guess what is the status of the body's blood vessels. For example, kidney, heart, brain, all these are supplied to blood vessels. What we see in the eye, from that we can make out what is the general condition of blood vessels throughout the body. So it's a window to the brain, window to the body, to the blood vessels of the body. That's what we commonly call retina as. Now, retina can be affected by various diseases. The most common huge burden on the socio-economic population of the country is the diabetic retinopathy. Diabetes is a very common disease. In fact, India is the diabetic capital of the country, of the world. There is no other country which has got more diabetics than what we have in India. And because of diabetes, over time, over 5 years or 10 years of diabetes, the patient, especially if the diabetes is not controlled well, it can affect the blood vessels of the retina. And when it affects the blood vessels of the retina, the circulation is affected. And because the circulation is affected, the vision will drop. And it can reach a stage, the diabetic retinopathy passes on stage by stage and can reach a stage where the blood vessels start bleeding. So that is the blood, you can see there on the retina. The blood vessels are seen and the blood clot is there right in the center, on the left side. So this is a very major problem. Fortunately today we have solutions for all the problems, all the stages of diabetic retinopathy. We used to call inoperable or diabetic retinopathy not being able to be operated upon in the past. Nowadays there is no such thing. Every stage of diabetic retinopathy can be operated. The level of complexity of the disease can be attended to by our complex surgeries with technology and techniques. And diabetic retinopathy also causes leakage from blood vessels. So before that, let me complete the bleeding part. So the bleeding part can be controlled by laser photocoagulation, laser treatment to the retina. This laser is different from the laser that we have talked about for cataract surgery. Laser treatment to the damaged blood vessels, to the ischemic retina. Ischemic means basically the retina which is not properly supplied by blood vessels, or which is no blood supply, and therefore it is suffocated. The retina is suffocated and not functioning properly because it is not receiving nutrition and oxygen. So that part of the retina can be treated with laser photocoagulation, and the complications of diabetic retinopathy, bleeding and loss of vision can be prevented. Simultaneously, there can be other changes in the retina due to diabetes, like for example, the blood vessels which have become weak can cause leakage, can result in leakage, and this can cause swelling of the retina. The swelling is, if it is present in the central part of the retina where The reading vision is, actually it is subserving the reading vision, which is called the macula. That can result in with the patient not being able to read. For that we have, this is the scan that we do to find out whether there is swelling on the retina or not. And this can be controlled or reduced by injections in the eye. The before injection and after injection, the pictures are there. So you can see that the swelling has come down. So this is another treatment, injection treatment.
This is a scan which
I know
is
it's-
done before and after. You can see on the left and on the right. Okay. After the injection, the swelling comes down.
And once the swelling comes down, the patient's vision is restored. So that is the magic of injections. But unfortunately, the injections are a little expensive now and have to be given repeatedly, and the patient's treatment is prolonged. As long as diabetes is there, this treatment has to go on and on. And when bleeding has already happened, I will come back to bleeding now. One is laser treatment to prevent bleeding. Now, if bleeding has already happened, if the blood vessel has given way and there is blood filling the vitreous cavity in front of the retina and blocking the vision, then the solution is by an operation called vitrectomy. Vitrectomy is an operation which is done with a very complex and highly sophisticated machine which Dr. Shilpa already has. She also has a vitreoretinal surgeon who is very well trained, and we from our MMTCI Institute also will be visiting this hospital to look after the patients with affected with these blood clots. The beauty of this machine is that it is sutureless. Surgery is sutureless. There is no incision, there is no knife used, only needles are used, and the size of the needle is 0.5 millimeter. Half millimeter is the size of the needle, and 3 needles are used to operate. One for the fluid to go in the eye, one for light, and one for the active instrument to cut what the blood clots and all that. So this is a very novel technique which is there for the last 15 years now, and the upgradation of the machine is happening almost every 3 to 4 years. New machines coming. So with half millimeter openings, we are able to operate complex vitreoretinal cases, complex problems due to diabetes. I am talking only about diabetes. There are other diseases also which we can use this machine for. For example, retinal detachment. Retinal detachment is another condition which is common in very high myopes. High myopes means patients with high thick glasses, -6 and above especially. They have weak retina, thin retina in which holes form, and once these holes form, there can be detachment of the retina. So to fix the detachment also, we need this machine, and with that the results are very good as compared to what was in the past.
Thank you.